shipping and maritime cooperation.
Ebola is a pandemic that is not confined to one place. And just for context, there has not been a single reported incident of Ebola in Kenya, just for context.
Yes.
So the big debate is going on, yes. But that is the correct position.
Absolutely.
Number two, the Ebola situation in Eastern DRC is a source of concern for any country, including Kenya, that is mindful of matters health of its citizens. And the responsible thing to do when there is reports of such high-level infectious outbreak in a region where we have thousands of citizens, Kenyan citizens in DRC. We have soldiers in DRC. The most responsible thing to do is to prepare for any eventuality. And that is what Kenya has done. We have prepared ourselves adequately. We have taken command of all our entry points. We are doing testing of every person coming into Kenya from anywhere near that region. We are testing close to between 2,000 and 3,000 people from all our entry points every day. We have mobilized resources, testing kits, reagents, and all manner of people. We have trained thousands of staff, health staff, to be able to handle that situation. We have now isolation facilities, 23 of them across the country, in different parts of the country. And one of the facilities that has now raised a bit of controversy is the facility we agreed to set up in conjunction with the Americans in one of our military air bases. And why have we done that? We have a huge American military contingent in Kenya, number one. Number two, we have set up the 23 other isolation places in Kenya with the support of friends, among them the Americans, our own resources, but also with the support of Americans. The American government has supported us in this Ebola setup infrastructure, health infrastructure, to the tune of 1.8 billion Kenya shillings. And they did make a request to us to, in the process of setting up all the other facilities, to also set up one where they can use in the event that their citizens, their soldiers, some of them in Kenya or from elsewhere, if they are in a situation, then they can use that facility.
And Ebola, clearly, as President Ruto has said, it's a pandemic. It's a pandemic that should concern all of us on the African continent. And as South Africa's role is the champion for the prevention of these pandemics, we have been quite deeply involved in the process of dealing with Ebola on our continent. But as South Africa itself, we've decided that we will be very proactive and be Pan-African and support the efforts that the African continent should make to deal with Ebola. We've made a contribution, as you might well have heard, of $5 million to the AU CDC to strengthen the CDC's effort to ensure that we have all the resources to be able to fight and to deal with Ebola. And for us to do so is to protect the peoples of Africa, but so also that when we protect South Africa and make sure that we do not in any shape or form ever have Ebola, we're protecting the whole continent as well. And so this contribution is meant to strengthen health systems in the DRC, in Uganda, as well as the AU CDC will be making that type of initiative, because our health systems on the continent do need to be not only strengthened, but there needs to be readiness to deal with pandemics like this. And in this regard, we call on all other countries and institutions that are able to lend a hand to make a contribution to enable the AU CDC to be able to deal with this challenge quite effectively.